Good afternoon,
Mike,
everyone.
Mike, are you showing
Welcome
the
and
new FIP slideshow?
congratulations on attending Financial Independence Planning's 2024 live stream on Medicare and Social Security. My name is Mike O'Donnell. I'm Financial Independence Planning's marketing manager. We have an exciting program this evening, and your attendance tonight shows that you are serious about making smart choices with your money. Tonight, we have a few speakers, including our founder and CEO, Harry Keller, our president, Jared Keller, as well as our chief marketing officer, Carolyn Cho, and our featured speakers are Ryan Haysbrook, who is joining us from BlackRock, and Erwin Cherry from My Benefit Advisor. Firstly, I would like to introduce Harry Keller, our founder and the CEO of Financial Independence Planning. For over 25 years, FIP has helped individuals to make smart retirement decisions and has trained financial advisors to continue to help those individuals, their families, and their friends. He was also named Best in State by Forbes for the past 4 years. Today, FIP has a staff of over 25 team members to help families stay on track to their goals. In addition, Harry was named to the Financial Times list of top 400 advisors in the US every single year since 2021, and to Philadelphia's 5-star wealth management every year since 2014. Harry, are you with us?
I am. Well, thanks, Mike, for the introduction, and I'm so glad to see all your happy faces. Hope you had a great summer. The family's well, and you're having some fun. I want to personally thank all of you for trusting us to help you with your family's financial decisions, and for the many introductions to others like yourself who we can help. We probably ran 100 seminars now on Social Security and Medicare, and these are some of the toughest decisions to make. And I'm glad that we have some pros here to help you. So if you have any concerns, after this, or questions that aren't answered, feel free to call your advisor, and we'll connect you with the pros to help you make the right choices. So I want to also thank Mike for the introduction and the hard work he's done orchestrating tonight's live stream. I want to also thank our speakers, Erwin Cherry, who's going to help with Medicare, and Ryan Hazenbrook, who's going to help us with the Social Security. So operationally, everything's good with FIP. We're back to work in Conshohocken and Lansdale. With Zoom, we've been doing virtual checkups now. It's almost 3 years, and that significantly helped our effectiveness and the and sharing of information with the virtual meeting. So, but if you like, we're happy to meet clients in either of the offices. And I also want to thank the FIP team of financial advisors and client services professionals. So as Mike mentioned, we have 25 people. We have 9 advisors and around 10 client services people and 6 additional staff. We have a base of clients of over 800 now, hard to believe, and we manage over $700 million. So we work very hard on maintaining things in the middle of the road for you, and we're looking at another very good year. Again, we appreciate you, and we'll continue to improve our services for you. Again, thanks for being loyal clients and for your many referrals to people like yourself who we can help. What I'd like to do is introduce Jared Keller, my son, and very proud of Jared. He's been working with us for now over 12 years, and he worked his way up, from the beginning, first as an intern for 3, so it's actually probably about 15 years now, through client services, and then as a senior financial advisor, and then became the manager of new business, and now is president of FIP. So, Jared, we'll pick it up.
Thanks, boss. Great to see everybody tonight. Hope everybody had a great summer. Go Eagles. If you're not an Eagles fan, go Eagles anyway. Anyway, great to see everybody tonight. We once again have another great session. What I love about these seminars, educational events is, that's the last step of our process, fun and educational events. We really feel that's what helps us be unique. It's not just providing excellent client service and experience. It's really continuing to educate you guys. And another great thing that I tell my clients is I don't have all the answers. I wish I did. But what we have at FIP is all the resources. So tonight is a great example when clients call with Medicare questions and Social Security questions, many of which we do know, we say no problem. We have all the experts at our fingertips to help you make the most informed and accurate decisions. So again, my brief introduction to our company. What do? We help our clients worry less and enjoy life more by instilling confidence through a comprehensive lifelong financial plan. Our unique 8-step process delivers an unparalleled level of customized service, allowing our clients to experience a more fulfilling life. I actually recently worked with Mike really hard on these 2 sentences to really capture exactly what we do. One of the best ways I know I'm fulfilling this and my advisors know I'm fulfilling this is when I get messages or emails from my clients. Jared, I'm in Italy. Jared, I'm at the new house. Jared, here's pictures from my grandson's baseball game. So we're constantly getting such amazing feedback of our clients enjoying their life. And obviously the fact that they want to share it with us is amazing. So we have a unique 8-step planning process, which has really been the foundation of our business for 30 years. So next year, we're celebrating our 30th anniversary, which is so exciting. So as all of you know, what our process is, step 1 is a referral. As you guys know, we're not on the radio. We're not on TV. We don't bring anyone off the street. We have an amazing group of clients. We just look to duplicate our top clients by ideally getting introductions from you guys to friends, coworkers, children, or other family members. And again, step 2 is that informational phone call or meeting. It's the easiest way to have a conversation with somebody new and really get to understand, hey, what are you looking to accomplish by working with a financial advisor? And then give them a real in-depth explanation of our company, our process, and most importantly, how we help keep our clients on track to their goals. The 3rd step, as you guys all know, is their financial roadmap. It's really an amazing meeting because it's not just what are your investments. We sit down with them or them and their spouse and go, what's important about money to you? Let's review all your goals that require money and planning. And then we don't just organize all of their assets, all of their incomes, their expenses, their real estate, their liabilities, their insurances, are their wills up to date? I mean, it is one of the most comprehensive reviews to make sure your financial household is in order. And as I tell everybody, the next step, really the most exciting step, is we put together a comprehensive financial plan using one of the top financial planning softwares in the country. As you guys know, who are all clients, you get to review this amazing experience every time we do a review, whether it's in person, over the phone, or through Zoom. But when we meet with those introductions, these important relationships, I can tell you it's one of the most unbelievable experiences they have, because for most of them, it's the first time they see, looking at their total financial household, hey, we are on track to our goals. Can you imagine, and many of you can remember seeing your plan for the first time, how it feels working 30, 40 years, wanting to have confidence you can retire, wanting to know if your money can last the rest of your life, and seeing that you're on track to your goals with the confidence through a trusted advisor and one of the top softwares in the country. So presenting that plan is always an amazing experience. And as you guys know, we don't charge for the plan. We just ask if the recommendations are significantly better, that those introductions would move forward. And if they do, the next step is the alignment review, which is where we get them logged online to our great online technology. Many of you use Allbridge, which is up-to-date performance reporting. We have the My FIP experience, which is where you can view your net worth and all of your investments in one place. And then, of course, AdviceWorks, where you have all of your documents as well. You know, the foundation of our practice is also those regularly scheduled checkups. Many top advisors we train with, one phone call a year, and they say, well, we do other touches like emails and maybe other correspondence. We pride ourselves in those regularly scheduled calls, and not just to update you on the finances. We sincerely care about you guys. So I love calling my clients, hearing what they're doing for fun, what's going on, celebrate with them or be with them through tough times as well. And also update that financial plan, give them that ongoing confidence they're on track, and review and make adjustments to their investments as needed. And of course, that annual checkups, just like really all the other ones. And number 8, like I already discussed, we pride ourselves in why we're different and unique, is the fun and educational event. So we really want to deliver not just this amazing financial planning experience, but an experience that's really elevated by delivering all this other fun and educational stuff to our clients as well. As many of you know, this is what the decision center on your financial, your MyFIP program looks like. But again, this is the experience clients see based off of your income, your expenses, and your assets growing at a reasonable rate of return and a reasonable rate of inflation, where your money will be at 90 or 100 years old. Now, of course, this is a sample plan and everybody looks different, but this allows us to empower our clients to show them that they are more than on track to their goals, or if they're not on track, what they need to do to be on track to their goals. And this clear visual is so powerful to many of you, just so you can clearly see, wow, we're in great shape. And this truly is how we help our clients worry less and enjoy life more, with that long-term picture of clarity. And of course, most importantly, we monitor that regularly. One of my favorite pictures, this is our team. We've got 10 financial advisors, 13 client service representatives, in-house accountants, in-house estate planning attorneys, and again, all of the other resources. You have Medicare questions, Social Security questions, estate planning questions. We have all those resources as well. I just want to thank you all. You guys are so important to us and our firm. We cannot wait to celebrate 30 years with you guys. Most importantly, again, as always, if there's other people, friends who would benefit from being part of our community, make sure that they reach out to us. And go Birds. I'm going to send it over to Carolyn. Carolyn?
Good job, Jay.
Thank you. Thank you, Jared. Thanks very much. So we're going to start, I'll kick off with Medicare, and it's wow, Medicare. It's another milestone in your life, and we are very fortunate for those of us who get to reach this milestone. But it's a big senior moment, and yet when we're faced with this, those of you who are coming to it or facing it or have just faced it, you'll see your mailbox is just stuffed with lots of mail from many different insurance companies and insurance plans, with an alphabet soup of Medicare supplement choices from A to literally Z. And fortunately, as Jared says, we're here to help you with that plan. But we don't do this alone. We do this in conjunction with experts. We've relied very heavily on top experts from My Benefit Advisor. Some of you have crossed that Rubicon into Medicare with Peg Shortino, might be a familiar name. She has since retired, but she her legacy continues with Erwin Cherry, who I got to know. Many of my clients retired in the last 1 year since Erwin has taken over at My Benefit Advisor, which is a comprehensive insurance planning company here in this local area. And Erwin comes to us with a lot of experience, particularly in Medicare. He's extremely knowledgeable. He's a Medicare, I would call him a Medicare guru. And he offers best-in-class service for those of you who benefited recently from his expertise and advice. And he's also very patient. He'll go through every drug RX listing that you need taken care of. So without further ado, let me hand this over to Erwin to take us through Medicare.
Well, that was an amazing introduction. Thank you so much, Carolyn. Hello, everyone. I just want to say thank you to Harry, Jared, Mike, and of course, Carolyn, and the entire FIP staff. All right. So what we're going to do is we're going to get into Medicare and just learning the basics.
Ryan, there should be an option at the bottom of your screen to share, but if you're having some trouble, I can pull your slides up as well.
I think I got it. Okay, here we go. Can you see it? Wait. Hold on. Did it go?
Not yet.
Hold on. Okay, here we go.
There you go.
All right, here we go.
You're live.
All right. Okay.
Perfect.
Perfect. Thank you. Sorry about that.
No worries.
There we go. Okay, so when it becomes your first time enrolling into or signing up for Medicare, there are a few places that you can go to apply. The first place you can go would be to ssa.gov, so you can apply online at Social Security. The other thing that you can do is you can visit your local Social Security office. Lastly, of course, is you can call the 1-800 number, although I wouldn't totally recommend it. It takes forever to get somebody on the Social Security line. You may qualify for Medicare if you are automatically enrolled, meaning if you are receiving retirement benefits from Social Security. So if you are 65 and already receiving benefits, you will automatically be enrolled in Medicare. But other than that, you would have to apply. You may need to sign up for Part A and Part B if you are not receiving Social Security benefits. All right, so the breakdown of Medicare. What is original Medicare? I get asked this question all the time. What are the different parts? You always see these different letters. Let's just focus on original Medicare. Original Medicare comes in two parts. So you have your red, white, and blue card, and it comes in Part A, which is your hospital insurance. Most people get a premium-free Part A. And the reason that being is because you've been paying into Social Security for over the past 10 years. So you and your spouse would also be included in that, and you do not have to pay a Part A premium. The second part to Medicare is Part B, as in Bravo. So that is the medical side. Okay. IRMA is based on your IRS tax filings for the prior 2 years. So IRMA is an income-related monthly adjustment amount. So everyone pays into Part B, but everyone's range into Part B differs. Okay, so there is a tax filing that again Ryan will go over later on, and he'll be able to kind of explain some more of IRMA, but I can give you again some information on IRMA as well. Okay, so what does Part A cover? Or what is, again, original Medicare, and what is this coverage? The first coverage is your inpatient hospital stay. So an inpatient hospital stay comes in at $1,632 deductible. So God forbid, if there's ever a hospital stay, that would be the immediate cost. That covers you for the first 60 days. After the first 60 days, day 61, you would have to pay $408 per day for the first 61 to 90. And then there is a lifetime benefit that people can reach, but it is $816 per lifetime reserve day. So anything past 90 days, it is $816. What is a skilled nursing facility or skilled nursing care? Hip surgeries, and you need to learn how to walk again. If you need 24-hour nursing care, there are facilities, skilled nursing facilities that are in different areas that you can go to and get your care. So for the first 20 days, there's no cost. And then after the 20 days 21 to 100, it is $204 per day. After days 100, the entire cost is on you. And then, of course, we have the conversation, about hospice care. Nobody likes to really talk about it, but hospice is approved by Medicare. And it may also include some medications. Now, your Part B coverage. Okay, so what is your coverage for Part B? Part B covers your doctor's visits. Part B covers 80% of the doctor's cost after the yearly deductible is paid. The yearly deductible for 2024 is $240. That could change next year. We usually get some information around October to November if that annual deductible has changed. But for 2024, it is $240. Your Part B premium will be deducted directly from your Social Security check if you are taking Social Security. However, if you decide not to take Social Security, then your Part B premium will be billed to you quarterly. The Part B late enrollment penalty. If you do not sign up for Medicare Part B when you're first eligible, you may have to pay a penalty to get it later, which will last you for as long as you have Medicare. However, if you meet these 3 conditions, you will not receive a penalty and you do not have to enroll in Part B at all. Okay, so number 1, you have to be actively employed. Number 2, you have to be on credible group coverage. And lastly, the employer has to have more than 20 employees, whether that be part-time or full-time. Just as long as it's 20 employees, and as long as those 3 requirements are met, you do not have to enroll in Medicare. You can forego it and you can stay on your active employer's health coverage. Your enrollment period, if you or your spouse is working and is covered under a group health plan, and the penalty can be 10% for each full 12 or 1 year period that you could have had Part B, but you did not sign up for Part B. So here's to take a look at the 2024 Part B enrollment rates. So again, it ranges. It starts at $174.70. And this is for individuals, and this is also as well as joints. So if you take a look at your finances and you fall into this bracket, take a look at the far right, and that's how much you'll be paying per month for your Part B premium. So what are your options when it comes to Medicare? Everyone, I'm pretty sure a lot of people have heard of a Medicare supplement, or also known as a Medigap option. That's option number 1. And option number 2, if you haven't seen the Joe Namath commercials, the Jimmy and JJ Walkers, that is your Medicare Advantage commercials. Okay, so we're going to dive into both of these guys. Okay, so option number 1 is your Medicare supplement insurance policy. Your Medigap policy is going to fill in the gaps left over from Part A as well as Part B, and is going to create a fixed cost and a peace of mind. All Medigap plans are standardized, meaning that they are all the same, guys. There's really no major difference between one or the other. So if you have one plan, it looks exactly the same, even if the cost is different. More doesn't always mean, just because you pay more doesn't always mean you're going to get more. And this is that instance. So here's a graph on some of the letters. Now, again, you see all these letters and everyone sees these letters and they immediately go, I don't know what K is, L, M, N. I don't know any of this stuff. Erwin, can you please simplify this for me? Absolutely. F is only offered to individuals that were eligible for Medicare before January 1st of 2020. So if you are eligible for Medicare before 2020, you are still eligible for Plan F. Plan F pays for every single thing, even the Part B deductible. So it pays the Part B coinsurance, it pays fully the skilled nursing facility, it pays the Part A deductible, it pays the Part B deductible, it pays any excess charges for foreign travel emergencies, and so forth. After January 1st of 2020, if you're eligible for Medicare, if you're for Medicare, then you will look at Plan G, as in Gregory. Plan G, as you can tell, looks exactly like Plan F. The only difference is it does not pay the Part B deductible. So that $240 would be the only thing that you would have to pay for in Plan G. Everything else is covered. And lastly, which is a decent plan, but most people go for Plan G because it's the most comprehensive, but decent is Plan N, as in Nancy. So N has copays for doctor visits, which are $20, and for emergency room visits, which are $50. It does pay your Part A deductible, but it does not pay the Part B deductible. It does not pay excess charges. Those are pretty much, guys, the three plans to take a look at. All the other ones are not even worth your time, I promise. The last portion of option one is the prescription drug plan. Most have a deductible. So it kind of ranges on premium compared to deductible. The lower the premium, the more the deductible, and the higher the premium, the lower the deductible. So there are 4 stages when it comes to the prescription drug plan. There's the deductible stage, which can be as high as $545. And that $545 deductible is triggered if the medicine falls on a certain tier. That can go into detail at another time, but that's just a brief summary. Then you have your initial coverage stage. Your initial coverage stage is when you're going to get the most discount you can for a prescription that you need to fill. How it works is you and the prescription drug company are going to pay an amount for the medicine. Once you guys both have paid a maximum of $5,030, then you will go over into the donut hole. Now, a lot of people may be aware that the donut hole will be going away in 2025, but it's still something to talk about now, just in case somebody wants to get into this within the next few months. The donut hole basically shares the cost from the prescription drug provider onto the consumer at a 25% cost. And then lastly is the catastrophic. It sounds way worse than what it is, but it's actually a good stage to be in. The catastrophic stage is going to give you the least amount for the medicine. So the medicines will go down to 1, 2, 3. Usually there's like a 5% co-insurance to pay for the medicine. Medicare Part D is also mandatory. If you do not get it, then you will pay a penalty for it. Here's the Part D IRMA adjusted. So not only is there an IRMA for Part B as in Bravo, there's also an IRMA for Part D as in your prescriptions. So again, it starts as low as $0. So depending on how much your plan premium is, you just pay the plan premium and that's it. But again, anything excess over 103 for individual or 206 for joint, it's an additional $12.90 plus the plan premium on top to get your Part D. The next option is going to be your Medicare Advantage plan. So this is option number 2. Original Medicare gets put to the side, but you are still required to pay your Part B premium. Medicare Advantage plans roll all the benefits into one plan, including the drug benefit, and it works the same way as a standalone Part D plan. Medicare Advantage plans have their own network of healthcare providers, and it's important to check your plan's providers network to make sure that you get the care that you need at the lowest cost. All Medicare Advantage plan must be as good or better than original Medicare, and they also include dental, vision, and hearing benefits. So guys, here are some resources when it comes to Medicare. These are some of my favorite sites that I send a lot of my clients to. Medicare.gov. Medicare.gov is a great place to go if you have a procedure that you think of that you're going to get within the next few months. Go to Medicare.gov. If you want to check to see if there's a provider or facilities or anything like that, go to Medicare.gov. It is your one-stop shop when it comes to receiving information on Medicare. But when you want a detailed description of how to dissect it all, then that's when you call me. MyMedicare.gov is where you can check your enrollment status and your Medicare claims. And of course, as I said earlier, SSA.gov is where you're going to go to enroll in Medicare. You can see your latest Social Security statement. You can change your address, and you can, of course, replace your Social Security card. I want to thank you guys so much again for your time. Thank you for allowing me to present some amazing information when it comes to Medicare. I do this every single day. I enjoy it. As Carolyn said, I'm patient. I love what I do. I love helping my clients. I love basically being an integral part of setting the tone when it comes to it. So here's my information. If you have any other questions, I appreciate it. Thank you so much.
Thank you. Thank you, Erwin. We're going to have questions and answers at the end of both, unless Harry, you want them to have any
I
questions?
think it's really good to do the questions and answers on Medicare now, because
Okay.
some of the people that are already on Social Security or are on Social Security, they can't make a change. But, and my question is, and this might be others, what's the change in the donut hole for next year?
Yeah, so they are completely doing away with the donut hole. They are capping the out-of-pocket for consumers to $2,000. So you will have a deductible stage, you will have your initial coverage stage, and then there's just a cap of $2,000 that someone will spend on their medicines, and that's it.
So that's significantly better than 8,000, right? So,
Absolutely, yes.
all right, good. That was my one question. Any other questions, Carolyn, that we got for Medicare?
I think we got a couple of them. Let's see. Can I stay on my on the plan, my company's health insurance plan after I turn 65?
Again, if you meet the 3 requirements, if the group health plan is creditable coverage, which your employer should know, or HR should know, there are more than 20 employees and you're actively still working. If you have those 3 requirements met, you do not have to enroll in Medicare. You can forego it until you're ready to actually retire, or one of those requirements are not met.
Is there a penalty though, for not joining at 65 and delaying it if I'm working past 65?
No, there's only a penalty if you are eligible for Medicare and one of those 3 requirements are not met. Then you can begin to start accruing a penalty. So Medicare gives you 3 months prior to the month of your birthday, the month of your birthday, and 3 months after to enroll in Medicare. So if you were eligible, your employer has 19 employees, and you just was like, oh no, I thought that I didn't have to enroll. Erwin said there has to be 20 or more employees, have to be actively working, and you have to be on a creditable group health coverage. So if any one of those is missing, or one of the 2 or 2 or 3, if any of those are missing, then you have to enroll in Medicare. And yes, there will be a penalty if you do not enroll in time.
How about medical underwriting if you don't enroll at 65 and you meet all those 3 requirements? Is there medical underwriting later on?
That's a great question. No, there is no medical underwriting, because technically that would be your first time being eligible to get into some sort of plan, whether it be a Medicare supplement plan. But Medicare supplement plans will not require medical underwriting. As long as this is your first time enrolling in Medicare after you have retired or you stop working.
Okay. Other questions from the group? Well, feel free to ask questions later on. We can send them on to Erwin, and he can also reach out to you with your questions. It is obviously a time of great change. You look forward to this day because it's a great social service, but it's complicated, as he said, from A to Z. He's been at the top of the ticket in terms of, he came highly recommended in terms of his expertise in Social Security. Obviously he's our go-to person because there's just, there's as many questions as there is many facets of Social Security. He prepared a multi-deck here, but we've asked him to taper it down because it is a very encyclopedic knowledge that he has. And again, he can't cover every single aspect of it tonight, but if you have questions, please feel free to ask us and we can forward it on to Ryan. So without further ado, Ryan, the stage is yours.
Perfect. Thank you, Carolyn, and good evening, everyone. Want to thank the team at the FIP for having me, and my partner Corey Mitchell with Jackson, who kind of linked us all together. So really appreciate the opportunity to spend a little bit of time with you. And sounds like most of you are probably pretty familiar with Social Security. So what we'll do is we'll just kind of generally go through the concepts, maybe just a good refresher on how Social Security works mechanically. I will ask you to hold any questions with regard to personal circumstances and share those with Harry and Carolyn and the FIP team separately, as those are questions I can't necessarily address, but certainly as it pertains to the mechanics of Social Security, happy to answer those questions that you have. Before I get started, just wanted to introduce my firm, BlackRock. You may have heard of us. We are the world's largest asset manager. We advise well north of $10 trillion under management, which is a pretty colossal number, and we do that on behalf of individuals like yourself, predominantly retirees, folks that were cops, teachers, firefighters, pension holders, your everyday American retiree. And we really appreciate your trusted advisors that entrust us with your financial security to help address the needs that you have on an everyday basis. Beyond that, though, we actually, beyond being the world's largest asset manager, we're the world's largest risk manager. And, we advise, well north of the 10 trillion number that I quoted earlier, on behalf of insurance company general accounts, pension funds, endowments, sovereign wealth funds, so on and so forth. We actually helped unwind Greece's debt. We helped the Federal Reserve with the bond purchase program during COVID. So we have kind of far-ranging capabilities beyond just what we do from an asset management perspective. And what I will say is that we've done well by doing better for our clients. And if you're a client of ours, that we sincerely appreciate your business and support and the help with your financial security. So without further ado, let me bring up the deck here. Hopefully we don't have any issues with that. So let me begin sharing my screen and just let me know if everybody you can see that okay. I'll assume that everybody can. So, let's just start off here. Obviously, Social Security is obviously one of the keystones of a solid financial plan, and obviously, one of the really, really important factors to maintaining a successful retirement. And, we want to, like I said tonight, just walk through kind of the basic mechanics of Social Security. If you've got questions, certainly feel free to throw those out. So if we look at Social Security, we know certainly that most folks are living longer. We know that, between a husband and a wife, that one of the two of them have a 50% chance of reaching their 90s. If we look at most American retirees, I don't know what your personal family background is, but if I look at my family, I had two grandmothers live up until their upper 90s. My most elderly grandmother just passed away at 97 years old, bless her soul, and my other grandmother passed away at age 92. Both of them obviously kind of eclipsed those milestones, but with the advent of healthcare, what I'll say is the advancements of healthcare technology, people are certainly living longer, and we certainly need to factor that into not only getting to retirement, but getting through retirement at the later stages and ages that we get to nowadays. However, we've got kind of a little bit of a trade-off here, and the trade-off is essentially this, that many folks, even though they're living longer, have made the decision to collect Social Security a little bit early. And we see that about 36% of American retirees are collecting a full or increased benefit, meaning they waited beyond their full retirement age, to whether that was 66 or 67 at this point in the game. But we see the better majority of American retirees are actually collecting a reduced benefit, and we'll walk through mechanically how that works. So counterintuitively, people are making decisions to collect early, even though longevity would tell us that most folks are going to live, potentially well into their 90s at this stage of the game. And matter of fact, I think currently your average male life expectancy is age 85. Your average female life expectancy is, age 97, or excuse me, age 87 rather. So, we obviously want to make sure that you're getting the full benefit of, your Social Security benefits. So the first kind of part of this presentation, we're just kind of going to walk through the rules of the retirement benefits, and then we'll get into collection strategies a little bit later on. So let's kind of dive right in here. So if we look at the individual benefits, many of you are probably familiar with the Social Security statement. You probably elected to receive it paper copy. You do have the ability certainly nowadays to, get it electronically if you so choose. However, if you do make the decision to receive your Social Security statement electronically, you are kind of locked into that decision, and you will not receive a paper copy. You can get that on ssa.gov, and that's where you can, view your Social Security statements if you're not already receiving the paper copy in the mail. But what this statement will tell you is your 35 best earning years and what you're going to be eligible for in terms of Social Security benefits beginning at your full retirement age. So if you haven't looked up your statement, I encourage you to certainly do so on ssa.gov. And on the right-hand side of the page here, what you're going to see again is what your monthly benefit amount would be depending on the age that you start. Obviously, if you wait a little bit longer from, 62 to full retirement age, at full retirement age, you'll get a, full amount that's stated on that benefit, or at this point in the game, depending on your birth date, at age 67. Or if you wait until age 70, where you would get a kind of 8% deferral credit and the benefit amount available to you annually if you wait until age 70. Now, the one caveat I'll throw out here is that it doesn't make any, there's no additional benefit to waiting beyond age 70. You've kind of maxed out your deferral credit. So I would, encourage you to begin collecting benefits at age 70 if you haven't already done so, because there's no additional benefit to waiting longer. So if we look at, kind of the trade-off for individual benefits, obviously you can begin collecting Social Security at age 62. However, there would be a reduced benefit. If you wait until full retirement age, you receive your primary insurance amount, or PIA as it's known, and then certainly increased benefits if you wait until age 70. So if we look at the full retirement age, your birthday scale kind of looks like this. If your birthday is 1937 or earlier, your full retirement age would be age 65. The full retirement age would be for 66 years old, 1943 to 1954, or age 67 if your birthday is 1960 and later. Now, you're probably going to ask, well, what if my birthday is somewhere between 1954 and 1960? Well, you would just be tacking on 6 months from your birthday until you got your year. So for example, my folks right now are 69 years old. They began collecting their Social Security age 67. Their full retirement age, or their birth year was 1955. So their collection date was actually age 67 plus 6 months to account for what their birth year was in order to collect full retirement benefits. So if we look at, making the decision of collecting early, the cost of collecting early is kind of laid out here. If you decide to elect collecting Social Security at age 62, you'll be getting roughly 70% of your benefit at age 63, 75%, 64, 80%, so on and so forth, until you get to your full retirement age, when you get your 100% of your primary insurance amount that would be available to you. So as you can see, there certainly is a sliding scale of reduction in benefits. So to the extent that you have the ability to, wait until full retirement age to collect your Social Security benefits, the better off you're going to be. However, obviously, there's certain circumstances they may require you to collect early, and we certainly acknowledge those. And we'll kind of touch on those here briefly, which is essentially boiled down to these 3 items in our general consensus, which is whether or not you're going to elect to continue working longer. Obviously, some folks want to continue working beyond their, into their 60s and up into their 70s. If you do that, obviously that will factor into when you're going to collect Social Security. Obviously, longevity for someone like myself, where I've got longevity on both sides of my family, I would probably want to elect taking my Social Security benefits at age 66, or full retirement age, which would be probably 68 by the time I get there. Or if you've got a spouse that you're caring for, or if you're married, you want to factor into the benefits of not only yourself, but obviously the spousal benefits that you and your spouse are entitled to under Social Security. So if we look at kind of the trade-off, if we look at continuing to work and collecting early, there is obviously some drawbacks to doing so. So if you are under full retirement age and you are collecting Social Security, you have a income limit of about $22,320 a year. And if you go above that benefit, $1 benefits will be held for every $2 of earnings above the limitation. So there's a pretty significant drawback to drawing benefits while you're still working if you know that your income is going to eclipse $22,320 a year. If you reach full retirement age, $59,520 a year, you would have $1 of benefits withheld per $3 of earnings above the limit prior to reaching full retirement age. And then certainly the month where you've reached full retirement age and beyond, there's obviously no impact. You can continue collecting Social Security. There won't be a reduction in benefits if you continue to work, in the retirement years once you've reached full retirement age. Now, there is the ability to kind of change your mind once you've elected to start drawing your Social Security benefits, or a do-over provision, if you will, and that would be the request for withdrawal of application. Now, this is a one-time, do-over that you're allowed to do if you, begin your Social Security benefits, and within the first year, you want to withdraw your application. You would need to fill out this form available to you on ssa.gov. Once you submit that form, you'd have to repay the Social Security benefits that you've already received. And then you could, file for benefits at a later date later on down the road, hopefully at or past your full retirement age. So you make sure you're getting those full benefits. Now, obviously, I mentioned earlier that there's, guaranteed increases for electing to take benefits late. So at full retirement age, you'd receive 100% of your primary insurance amount. If you wait 1 year, you'd get an 8% deferral. So you get 108% of your primary insurance amount, 2 years, 116, and then 3 years, 124. So again, once you reach age 70, it doesn't really make a difference in terms of deferring any longer because you've kind of maxed out those deferral credits. So if you haven't started Social Security and you've reached age 70, you should, begin to do so. So if we look at the, benefits adjusted annually for cost of living increases, we've obviously with what we've gone through since, the COVID pandemic, we've saw some pretty healthy cost of living increases due to inflation in our economy. I think my folks received like an 8% cost of living increase last year for their Social Security. So as you can see, long term, the average is about 2.5% for cost of living increases for Social Security. In 2024, the cost of living increase is going to be 3.2%. So you can expect that COLA to, start when you start receiving benefits for this year. And one thing I will say is if you haven't filed for benefits and you're thinking about doing so, just to make sure that you get the cost of living adjustment, that's already kind of baked into the equation. So, if you're intending to defer taking Social Security benefits, but then have, heard about the cost of living increases and you're, looking to actually file for Social Security benefits to make sure that you get it, you don't really need to do that. It's already kind of baked into the equation already. So just food for thought and what you might need to know on that particular piece. So going to, that question of longevity that we mentioned in terms of when and how we want to elect or make the decision to elect taking Social Security benefits as it pertains to longevity. If you elect to, start taking Social Security benefits at age 62 versus full retirement age, the break-even point would be, age 78.5. If you look at taking Social Security benefits at, age 70, your break-even point, versus taking at, 62 or 67 would be age 82 and a half. So if you've got longevity, it would make sense to defer taking Social Security at a later date, because you get those cost of living increases. You get, obviously the deferral credits, and you really don't have to make it 12 and a half years to break even, versus, if you elect to take early. So, at a reduced benefit. So for what it's worth. So that's kind of the rules of retirement benefits on a general basis. So let's kind of look at the rules of, retirement benefits for spousal and survivor benefits. So in this particular presentation, we've got, Jordan and Alex. We're going to look at Jordan's primary insurance amount of $2,200 a year. Alex, from a spousal perspective, would be able to collect 50% of Jordan's PIA beginning at full retirement age. So, that would basically mean $1,100 a month for Alex in that particular equation. So if you elect to take Social Security early, or the person with the higher PIA amount elects to take Social Security earlier at a reduced amount. So in this scenario, Jordan's PIA is $2,200 a month. Jordan elects to take Social Security at age 62 at a reduced benefit amount. That would be $1,540 a month. If Alex were to wait to collect spousal benefits at full retirement age, Alex would still be entitled to half of Jordan's primary insurance amount, which would obviously kind of be the ideal scenario if one spouse needs to collect early. So if we look at spousal benefit reductions, this is kind of the rules of the road and how that works. So if you wait till full retirement age, you're entitled to 100% of that 50% of the higher income earners primary insurance amount. So if you were to collect early, you'd be getting 65% of the primary of what you're entitled to from a spousal benefit collection standpoint. If you collect 4 years early, 70%, 75, 83, 92, so on and so forth. However, if you wait until beyond full retirement age, it doesn't really matter in this scenario for spousal benefits. So you might as well just begin collecting at your full retirement age, because you don't get any deferral credits on spousal benefits if you wait longer. So you would want to elect to take your, spousal benefit, at full retirement age, just because there's no additional benefit to waiting. So if we look at spousal benefits and eligibility, so the way that this would work in this particular scenario. So again, Jordan, the primary earner in this particular scenario, Jordan has that PIA of $2,200 a month. If Jordan were to wait till age 70 to begin collecting Social Security, that individual benefit would have gone up by 24%, and Jordan would be collecting $2,728 a month in Social Security benefits. If Alex were to wait till age 70, in that same scenario, the spousal benefit would still be $1,100 a month. So there would obviously not be an increase, as we just talked about on the previous slide. If we're looking at suspending benefits, it's still available, but with kind of new consequences. So depending on when your birth date is in this particular scenario, and let me see if I got my notes here. So bear with me 1 second. If you look at the partner, I think it's the birth date is the cutoff is in 1950, I believe. Don't hold me to the fire on that one, just because kind of file and suspend and some of the unique tricks that you use to be able to play with Social Security collection strategies have kind of gone away. But the partner must have filed for individual benefits with no suspension. If we look at the individual and spousal benefits, they are going to be netted against each other. So if we look at Jordan collecting early at age 62, that would be a reduced benefit by about 30% of $1,500 a month. If Jordan were to suspend and no benefits, were taken under file and suspend, the benefits would accrue in the 8% annual increase. And then collecting at age 70, you would have a increased amount under file and suspend of $1,900 a month, roughly speaking, and that would have increased by about 24%. Like I said, there's a benefit cutoff on that, I believe, Your birth date had to be 1950 in order for that to happen. I don't have it in my notes here, unfortunately, but that particular scenario isn't necessarily available to most folks anymore that are looking at collecting. I believe it was April 30th of 2016 is when that cutoff began happening. If we look at the impact to a spouse in that scenario, the spousal benefit that would be collected a reduced amount, that 35% reduction that we looked at on the previous slides. Alex would be collecting $715 a month. When Jordan elected to suspend the benefits, that spousal benefit would be turned off, and then the spousal benefit would begin again once Jordan had continued benefits, and again it would be at that same $715 a month. So again, this isn't a strategy that's still available to most folks. Especially if you're already in retirement, I wouldn't encourage you to try to look at any type of file and suspend strategy on a go forward basis, because it's kind of a sunsetted deal, unfortunately. If we look at adding spousal benefits to individual benefits, this is mechanically, roughly speaking, how it works. So if Alex was going to collect a primary insurance amount of $600, waiting till full retirement age, Alex would be entitled to 100% of that primary insurance amount of Alex's own benefits. If Alex elected to take, Alex's own benefits early, that would be a 30% reduction and would only be able to collect $420 of that $600 of primary insurance amount. And then waiting till age 70 would mean it would have an increase of 24%, and that would go up from $600 to $744 a month. If you add on to that particular scenario, the $1,100 a month in spousal benefits, that would be in addition to the individual benefits that Alex would be able to claim on their own, you're looking at an additional $500 of spousal benefits. So you don't necessarily get the $1,100 plus the $600. Both of those benefits kind of get netted against each other, and you get capped out at the $1,100. So again, you can't exceed that 50% of the PIA of the primary income earners, spousal benefit amount. So something to be aware of. But if you looked at the reduced benefits as well as the deferred benefits, this is what you look at. And again, you would still be maxed out at the $1,100 in our scenario. If we look at the spousal benefits eligibility, so in this particular scenario, you've got Jordan with a PIA of $2,200 a month. Alex has a higher PIA of $2,500. So if Jordan waited till age 67 or full retirement age to begin collecting individual benefits, that would be that $2,200 a month. If Alex waited till full retirement age, that would mean that Alex's PIA would be payable at that $2,500 a month. So if you've got two folks that are looking at collecting Social Security, and you've got one that's got slightly higher PIA, again, the best scenario would certainly be to take a look at collecting both benefits or individual benefits beginning at full retirement age. So if we look at survivor benefits, if we look at demographic trends and what we've kind of experienced with Social Security, women are collecting their husband's benefits. Husband's benefits are about 17%, their own benefit and husband benefits about 25%, and their own benefits only about 58% of the time. So if we look at mechanically how this would work, if Jordan is the primary wage earner, Jordan's got the PIA of $2,200 a month. Alex has a PIA of $600 a month. Jordan's benefits available to Alex in this scenario would be, roughly $1,800, so $1,833 a month of survivor benefits based on Jordan's PIA. If Jordan had waited till age 70, the benefit would have been $2,728 a month based on Jordan's PIA, and their survivor benefits would have been the same amount. So again, really good job of making sure that spouses are taken care of from a Social Security collection strategy standpoint. So that's kind of the rules of the road, if you will. So let's look at some actual collection strategies and how you can actually maximize what you get from Social Security in this particular environment. So if we look at, a married couple collecting at age 62, you've got Jordan and Alex again. The year of birth, 1960 and 1960 for both spouses. If you look at Jordan's PIA, $2,200 a month. Alex has a PIA of $600 a month. Jordan would live through age 75, Alex living to age 94. So if Jordan were to collect individual benefits beginning at age 62, that would mean $1,500 a month. So Jordan's total benefit amount over Jordan's lifetime would be $258,720. If Alex were to collect a reduced benefit amount beginning at age 62 of $420 a month, you're looking at an additional $70,000 a year, and that's kind of what the total would come to. Plus the adjusted spousal benefits would mean another $54,600 over that particular lifetime. So plus survivor benefits, you'd be looking at another $196,000 as well. So the grand total in this scenario collected would be $579,900 if everybody had collected early at age 62. So what happens in the same exact scenario when you begin collecting at full retirement age? So if both are age 62, you know that you're going to get $579,900. So that's kind of the number to beat. So in this scenario, if Jordan were to begin collecting Social Security at age 67 or full retirement age, you would ladder in Alex's primary insurance amount for Alex's own Social Security benefits would be another $600. Collecting the adjusted spousal benefits, getting up to that $1,100 threshold for Alex's benefits based on Jordan's spousal benefit amount based on his primary insurance amount. So if we look at both collecting at full retirement age, you're looking at $594,000 for both collecting at full retirement age, which is obviously a much better outcome than collecting early. So if we look at the same scenario and everybody's collecting at age 70, here's generally speaking what that looks like. It actually ends up being a little bit less money. So, think about that, how that might factor into your own scenario. Obviously, we can't project our own mortality. But again, if we're collecting at full retirement age, that kind of offers so far the best outcome for all parties involved. What happens if we have a married couple with a large difference in benefits? So here's how we might want to think about collecting Social Security to maximize the benefit that we get. So in this particular scenario, Alex would begin collecting a reduced benefit amount of about $420 a month. Jordan waiting till age 70 to start collecting benefits at that $2,728 a month. Alex would begin getting the spousal benefit amount at age 70 when Jordan filed for Social Security. So your total would end up being $599,760 overall. So there is a benefit to collecting some of your Social Security benefits a little bit early from a spousal perspective. And then obviously waiting for the primary insurance amount or the primary wage earner to start begin collecting Social Security at a later age and netting much more money in terms of benefits paid over a lifetime. In this particular scenario, if we look at a same scenario, but we have both spouses kind of living a little bit longer. So Jordan living to age 85, Alex living to age 92. If we look at, Alex collecting individual benefits early at age 62, that collection strategy would net you $969,000 versus just collecting at age 70, $964, both at full retirement age of $937, and both collecting at age 62 of $810. So this kind of appears to be the most optimal collection strategy based on total benefits that would be received for both of the beneficiaries from Social Security. However, obviously we know that longevity certainly must factor into that equation and what your own individual, health and wealth circumstances might look like. What happens when we have a widow with significant individual benefits? So in this scenario, we're looking at Chris, who had a primary insurance amount of $2,200 a month. a survivor benefit of $2,500 a month, and living through age 92. So you would want to, in this scenario, collect the survivor benefits first at a reduced amount. So you'd be collecting $1,700 a month of survivor benefits, and then waiting to turn on Social Security at age 70. So you would ultimately get another $2,700 a month in that particular scenario. And that particular strategy would net you out $967,000 over a lifetime in that particular scenario. If we look at a widow with lower individual benefits, so you look at Chris with a primary insurance amount in this scenario of $1,000 and a survivor benefit of $2,500, living through age 92. If Chris were to elect to start collecting his or her own Social Security beginning at age 62, that would be $700 a month. And then turning on their survivor benefits at full retirement age of that $2,500 a month. In that particular scenario, you would net out $822,000 over Chris's lifetime of collecting Social Security benefits, both the reduced or primary insurance amount and then their survivorship benefits, collecting the optimal time to receive the most amount of benefit over the course's Chris's lifespan in this particular scenario. If you've got additional beneficiaries, you or your retirement age spouse collecting benefits, say you have an unmarried child, your unmarried child would be eligible to receive 50% of your primary insurance amount, 75% of your primary insurance amount as a survivor. So if the child is under age 18 or 19 if still in high school, any age if disabled before the age of 22, that particular unmarried child will be able to collect 50% of your primary insurance amount. If you have a younger spouse, that would be 50% of your primary insurance amount if they are caring for a child who is under the age of 16 or disabled before the age of 22. If we look at additional beneficiaries, the rules are kind of as follows. You would need to be married to the ex-spouse for 10 plus years. So I think Johnny Carson is the famous case study in this particular scenario. I think Johnny Carson had like 4 ex-wives who were all collecting on Johnny's Social Security. So in that scenario, each spouse had been married to Johnny Carson for 10 plus years. They were currently unmarried. Both were at least the age of 62, and they've been divorced for at least 2 years. That would mean a divorced spouse would be able to collect on your Social Security benefits. If we look at how that works with survivor benefits, if you were married to an ex-spouse for 10 plus years, you were unmarried or married after the age of 60 or at least 60 years of age, the divorced spouse would be entitled to receiving your survivor benefits based off of your Social Security. So obviously we've come to the ever so, what I would say potentially changing world of the taxation of Social Security benefits. I think we've got, a lot of chatter from both sides of the aisle on wanting to reduce the amount of taxation on Social Security benefits. So hopefully that would mean good things to all of you should that happen. But generally speaking, the way that taxation of Social Security benefits works is something like this. Your provisional income equals half of your Social Security benefits plus your modified adjusted gross income. So if we look at the table and how that would work, if you are single or married filing jointly, if you're single, from $0 to $25,000 of Magi, you would receive 0% of benefits of taxable. 25,000 to 34,000, you are looking at 0 to 50% of benefits that are taxable, and then over 34,000 for single filers, 70 to 85% of benefits are taxable. If you look at married filing jointly, 0, 32,000, and 44,000 are kind of your thresholds on how taxation works. Now, I'm not going to get onto the weeds, but there's an important part of this that you need to be aware of as it pertains to Irwin's section and how he briefly touched on Irma. And this is a conversation that I encourage you to have with the FIP team. Irma is in effect a surcharge on your Medicare benefits based on your Social Security and your total income amount. Once your income in retirement eclipses $103,000, you are subject to the IRMA tax, which functions basically like an AMT tax would on income. So by de facto, it would reduce your total Social Security benefits that are actually being received by you going towards paying your Medicare benefits. So you would actually have a net I would say a net reduction in Social Security benefits received because your income eclipsed the IRMA threshold. So this is a topic that you'll want to make sure that you're discussing with the financial independence group folks to make sure that you are not being impacted by that particular issues. But it's something you all need to be aware of, and it needs to be on your radar. So make sure you have that conversation in your next financial checkup meeting or review with the team. So what are your next steps? Your next steps are essentially this. Make sure if you haven't, you go download your statement at ssa.gov, meet with your financial professional at the FIP group to review your personalized analysis. I would say there's a multitude of resources out there to look at Social Security. BlackRock actually engaged with the Social Security Administration to help build the Social Security calculator that we have available on our website that's for financial professional use. So your trusted team at the Financial Independence Group should have the ability to log in and use our calculator to give you kind of a analysis on when might be the most optimal time for you to collect Social Security benefits. And then you obviously would be able to incorporate that into your overall retirement plan. How to file for benefits. Number one, online is the preferred method. I don't know anybody that wants to go spend, a multitude of time sitting at a Social Security office. I drive by the one in Pottstown all the time when I'm on my way to the gym. It's always busy. So if you have the ability, I would encourage you to go online to ssa.gov, click on benefits, then retirement, and you would want to apply for your retirement benefits. I would highly, highly encourage you to do that while you're having a conversation with your advisor at the FIP group, just to make sure that you are collecting or filling in the application and what have you correctly to make sure that you are receiving the benefits that you are intending to receive. Your other option would be to be in person. You have to call the Social Security Administration at the number you see on screen, 800-772-1213. And schedule an appointment for an office interview to file for benefits. Again, I think that's probably a pretty painful process. So to the extent that you can avoid it and be a little bit more tech savvy, go online. And then last but certainly not least, you could call Social Security if you're not able to, schedule an appointment and go to a field office. You could certainly, do an appointment over the telephone and to review and file for your benefits as well. So that kind of brings us to the end of our presentation. Happy to answer any comments, concerns, questions, things that are front of mind that I can answer for all of you this evening.
Good job, Ryan. Carolyn, any questions or any questions from the audience? Hi, Carolyn.
Yeah, I'm going to turn it over to Mike. I think he was taking in the questions.
I do have a couple of questions here from our audience. So one question that I got, Ryan, I'm gonna see if I'm gonna have you answer this. Was if I go online to get my Social Security statement, do I get a paper statement?
If you go online and you elect to receive your statement electronically, you will not receive a paper statement. Otherwise, you would begin receiving statements in the mail prior to your age 62. I believe it's like 59 and a half is when they start.
Great. So another question that I got ahead of time was, can I continue to work after I file for Social Security? Ryan, I'm going to throw this one at you again.
Yep. So if you elect to continue working, kind of into your retirement years, if I go back to, I don't want to go all the way back in the slide, but there is a penalty for electing to collect Social Security and continuing to work because you are essentially running up against an income threshold at $22,300 annual income. And once you go over that 22,000, you're going to have a reduced benefit of like $1 benefits per $2 of earned income. Once you get just before full retirement age, you're looking at $1. So past 62 and close to your full retirement age, you're looking at, for every $1 of income over the threshold, you're looking at $1 reduced benefits for every $3 of income earned. And then once you get to full retirement age, it's a non-starter. You can continue to work and collect Social Security without penalty once you've received full retirement age. So the key here is, to the extent that you can avoid taking Social Security, while you continue to work prior to full retirement age, the better off you're going to be.
Great. Great. Do we have any other questions?
Yeah, Carolyn, I'm gonna wrap it up. Thank you. Thank you, Erwin. Thank you, Ryan. Very good presentation.
Thanks for having us.
I hope our FIP team, thank you for our FIP team, and thank you, valued clients. We will have this presentation on the website and on our LinkedIn shortly. Okay, and I want to thank Mike and Carolyn again for putting together such a well-done presentation and completed a little bit early. So I hope you all have a great summer. And if you have any questions, please give us a call. And again, thank
just
you
a few words.
Oh, yeah.
Just a
Carolyn.
few words, Harry. We have some really exciting other events coming up. And certainly we have capacity to help your guests and family to, as Jared had pointed out, to find the path to financial independence. And one of the things we do, the first thing we do is help you keep as much of your dollar as possible. And that's what we're kind of trying to do. In November 13th, come to the tax planning seminar. All of us, regardless of how little you earn or how much you earn, we want to give as little away as possible. So tax planning on November 13th, please mark that on your calendar. And then coming up really this week, we promise you lots of events. We got one in 2 days. On September 18th, we have lots of tickets still for the Iron Pigs. So if you'd like to go out, now it's not so hot also. It's a nice time of the year, early fall when it's perfect weather. And come out and enjoy the Iron Pigs. They're the AAA team to the Phillies, and they actually have had a really great year. So that's in the evening on September 18th, this Wednesday. If you need tickets, please email us, Michael, myself, Harry, anybody, any of the advisors. We'll be sure to get you tickets. And then coming right up shortly after that, October 4th, and correct me if I'm wrong, Michael, we have a gardening event at the Temple Arboretum.
It's the 25th.
It's the 25th?
We have that. So you have a little bit more time.
25th. I stand corrected. See, so we'll October. It's perfect. It's the fall season. Temple Arboretum is gorgeous. There is going to be a lecture, lunch, and a nice short walk around the beautiful fall colors of the Arboretum. So we promise you lots of events. And then, of course, check back in regularly. We're celebrating our 30th anniversary next year. We certainly would love to meet all your family and friends at many of our planned events and please check out our website with many planned events coming up for 2025.
Thank you, Carolyn. So Iron Pigs, which is a fun, we have plenty of tickets. This was they gave us extra tickets because we had another event rained out. That's Wednesday. So you can bring family and friends. We put up 60 tickets that are available. So it's nice that they, instead of the picnic area this time, they gave us each $15 food credit. So you can go to get your chicken and Pete's fries with your corn on the stick. Erwin and you guys, you're welcome to attend as well. Okay. And Ryan, if you're in the area, the Iron Pigs that's a beautiful stadium up there. It's similar to Hershey.
You had me sold on the chicken and Pete's fries.
Yeah, the chicken and Pete's fries are great. Yeah, we moved the garden event that we normally have a full house. And we bring in an arborist to talk about, your fall garden. And that'll be on October, it's on a Friday. And then they do a really nice tour of the Ambler Arboretum gardens. So mark your calendar. If you have any questions on Social Security, we have access to calculators, so we can go through all the options. Plus our financial planning software also will show you the best choices. And again, thanks for being valued clients. Have a terrific, yes, we're getting into the fall, right? Terrific fall, terrific autumn. Hope to see you all soon. Thank you.
Thank you, everyone.
Thank you, everyone.